Uh-oh, okay, we're about talking about. Cord.
We can mute it. like we have two or three folks on the phone.
I'm joining you with the computer mic. Is that working out okay?
Yes, that's great. Was that Frank?
Yeah, that's Frank.
Hi, perfect. We're just all getting settled in the room here, so just give folks a couple more minutes in case we've got anyone else coming, and then we'll get started.
Keep one of these open for a minute. Is anybody else coming here physically?
There's a chance one or two folks might come, so just give us 1 or 2 more minutes.
Here, across the elevator. We'll see.
Oh, that'd be great. Oh, thank you.
A lot more, yeah, than business and community categories.
That doesn't stay open.
Yeah.
If you kind of hold it in place for a minute or two, it'll,
Okay, move slower.
yeah.
Well, just lean back and don't move.
It's a posture trainer.
Just
right?
close your eyes.
Yeah.
We'll wake you up when it's over.
So it's a couple minutes past the hour here. We can go ahead and get started if anyone else comes in. Just, talk to them when they get here. So we'll start with some introductions. I think most everyone here is familiar with each other, but we'll just do real quickly around the table names just in case we've forgotten who anyone is. So I'll start. My name is Angela Johnson. I'm leading the health and safety impact team for the All Things Missouri project. If you remember, we're doing these series of 3 kind of focus group conversations. So thank you all for joining us for session 2. And pass that to you, Dale.
Sure. Dale, school social work.
Sarah, a nutrition and health specialist for the Northwest region.
Chris Barnett with CARES. I'm heading up the agriculture and environment impact team.
Jamie Kleinsorge, also with CARES, and I'm heading up the business and community team.
Chris Fulcher, CARES.
Kathy Bowman, school of nursing. Melissa DiBartolomeo, program analyst feasibility specialist at CARES.
I'm Michael Hardy. I'm heading up the youth and family impact area.
CARES, also uses the specialist.
Great. And it looks like we have 4 participants joining us on the phone. Would you like to go around and introduce yourself? Emily, you're first on our list here. Do you want to, if you're able to, can you start?
Emily, you may be on mute, Emily.
Oh, sorry, it froze for a moment. Hi, this is Emily Barbie. I'm joining you remotely via Zoom. I'm a nutrition and health education specialist with University of Missouri Extension in St. Charles County over in the urban east area.
Great. Erin, are you there?
Go ahead, Aaron.
We couldn't hear you, Erin, but we'll just we'll scoot on down the line here to Frank.
This is Frank Weidman. I'm the ag engineering specialist in Prairieville in the Southeast region. I noticed that Emily was using, or I'm sorry, Erin was using the chat box to introduce herself.
If you go to more, over on the right-hand side, there you got it, thank you.
Perfect. Hello. Hi, Erin. And Wayne, are you last on our list here?
Yes, ma'am, I am. I'm Wayne Pruitt. I'm the Regional Director for the West Central Region.
Great. Well, thank you all for joining us over the phone and on online here as well. So the flow of our meeting today, we're going to start with kind of a recap of our last session, especially for some of those who may not have been able to join us. Just real briefly go over what we talked about, and then we also would like to talk about some of the use cases in detail that we came up with. If you recall, at the end of our last meeting, we talked about not based on perceptions of the current platform, where could we kind of envision in the field using some of these tools. So we're going to review not only the use cases that the health and safety team kind of came up with, but also each of the other three impact teams, so the ag environment group, business and community, and youth and family. After that, we're going to take a quick break here, where we are asking each of you around the table here and on the phone to think about particular data sets that might fit within some of those use cases, and in particular, the reporting environment, as well as kind of our community crosswalk tool, which was that jurisdictional boundary tool, and then finally a kind of a site selection or location analysis application. On the board here, we have listed out some of the categories for our different, for the current health and safety report. So if you have an idea for a particular data set or kind of concept around data, we invite you to kind of use the Post-it notes on the table here and paste those up here on the board where they might fit. For those who are on the phone or on Zoom, you can either chat them in the chat box here, or we'll give you an opportunity to kind of provide your input over the phone if you're unable to chat with us. And then after that, we'll just kind of talk about some of these different data sets and go through the current report in detail. And then we may have an opportunity to look at some of our additional tools that aren't currently part of the All Things Missouri suite, but could potentially kind of inform some of what we're talking about today. Any questions about that flow?
And one kind of bigger question.
Sure.
And I should ask this last time we met, how does this, the data that you all have, differ from the MRDC?
The MRDC?
The Missouri Research Data Center on campus.
So the data center, they have access to the raw survey data for a number of different data sets. And what we usually are working with are more the kind of the public access versions, and sometimes they're like the more analytic component of those public use versions, but we don't house the kind of the raw research data files.
So, and Dale, I think this is something we should live into more, as CARES is now an extension. What is the research linkages to what we have in terms of data? So to her point, yeah, that's more the research level, the non-publicly available data. What we deal with is all the population level data, and that's really our domain.
Okay.
And so if there are opportunities, I believe, Chris, you've worked with the data center before on a project with Link, is that right?
I've worked with some of the people involved. I've not been in the data center.
But did you acquire any data or use any?
No,
of
I
their
did not.
data?
No.
Okay. So that's something, Dale, that,
Okay.
you know, as we learn more through this All Things Missouri, what is the research component of it? How does it tack on to All Things Missouri, and then also with these other research opportunities?
Yeah, and it's beyond just the RDC. I mean, they have some data products. There are other centers on campus that may have other, you know, kind of data repositories like the Medicare data, the cancer registry. So there are many centers that are working with research data files, and they're not, you know, talking to each other and not even sharing kind of the public use output from those. So I think there's opportunities for linkages there.
Okay.
Interesting.
All right.
So can you folks on the Zoom see the slideshow here?
Yeah,
So,
yeah, we can.
Okay, perfect. Thank you. Just wanted to check on that before we continue here. So we wanted to, as I mentioned, talk about some of the use cases that the other teams came up with. In these different sectors, we heard some overlap in terms of what different uses might be for the data and tools, as well as some kind of new ideas. And so we wanted to share those with you all in case it's something that kind of sparks a new idea that maybe someone that may have application in the health and safety work. So the Agriculture and Environment Group came up with a number of different ideas. We've kind of distilled those into these three unique categories for ag and environment. The first was around a citizen science approach, where they both talked about potential for kind of new primary data collection, as well as tapping into existing tools that exist for citizen science. One of the examples was around a tool that I think currently exists to collect information on algae blooms in lakes. So as folks see in real time what's happening in their kind of watershed area, being able to input that information to an existing system, and is there an opportunity for CARES, for All Things Missouri, to use that existing data as an output. So kind of researching, we know that there are a lot of citizen science tools out there. Which of those might be priority for linkages into our system? Another thing that came up during the Ag and Environment meeting was talked about the kind of recreating or repurposing a tool that we've previously developed called the Ag Site. So there were a lot of folks in the room who had kind of previously experienced or worked with CARES on building this application. So Ag Site was a website, a tool, a data tool that we developed in conjunction with Ray Massey to provide kind of targeted information about user-defined land parcels. So folks could actually go into a mapping application, draw the boundary of their farm or neighbor's farm or parcel of land that they're interested in on a map, and get a report with characteristics about that particular land parcel. So it was soil information, kind of environmental quality, land ownership, land usage, land cover. The ag team was really interested in this type of tool or application for kind of a revenue generating approach, because it had a lot of value for folks who are in the field. I think like FCS Financial, there's some banking institutions and lending institutions that are interested in that type of detail, but there are certainly other applications for a tool like that across beyond just the ag sector. And then the last use case that was specific to ag was really this agriculture economics report. So there is, I think, an annual report for Missouri about the impact of agriculture on Missouri's economy, kind of recreating some of that, looking specifically at data related to farm income, farm commodities, changes in farm population. So really a targeted report for the ag and environment, ag and economic sector. So any questions about those different applications? Oh, sure.
This is Frank Weidman. I work with a lot of small farmers, beginning farmers, and I've used Ag Site and Google Maps and some other things, teaching farmers how to identify and set as a data set field boundaries and stuff like that. Is that something that we could build into this model too, where they could have a layer that it was property boundaries, and then go in and identify other areas and points in there in other layers, perhaps?
Yeah, I think that's certainly an opportunity. It sounds like, as we mentioned, there's already definite interest in repurposing, recreating, or linking to the existing ag site. But we have developed over the years a number of ways in which folks can interact with dynamically a map, whether that's drawing boundaries and getting reports for specific custom drawn areas. I think it's really just a matter of, at this point, identifying which metrics are kind of the key output metrics for that type of application. And it may, I think that the question is, is it something that we're going to build a kind of a sector specific thing, like a tool just for ag, or is there a more community-wide tool that could cut across different domains? So it's kind of an open question. You want to add to that, Chris?
Yeah, and this is Chris. So keeping with that ag example, data is kind of like the soil. So we really need to know what data you want to have in the system. State level data, national level data, primary, secondary data. So that's really the soil. And then the tools are what we grow. So the ag side is just one instance of what we do at CARES. We can really build pretty much tailor an application or a tool that meets health and safety impact group needs. So if you take the ag site in terms of the indicators, the outputs that comes from the report, the way you interact with the mapping, we can do something different that's very much tailored for health and safety. So that's one of the big takeaways from this 3 working group sessions over the 3 months is what are some tools that we can build on top of the data that we're acquiring? Did that help answer your question?
Well, I'm kind of thinking about the need for some of these folks to maintain their data set and have those boundaries and important points that they use in their operation hosted on a site that allows them to come back and access that data, perhaps share that data and that kind of thing.
Sure. So, like talking about the ability to, have folks add not only, tabular data and collect tabular data, but to add their kind of custom geographic data and be able to store that or associate that with a login or something like that, or even share it publicly. That's definitely an option and something we at CARES have done in the past for various projects. At this point, really just understanding that use case and that application so we can build it the right way.
Yeah, that's yeah.
Great. So I'll move on here to our business and community use cases. So one of the kind of new uses for business and community was this idea of what they call a data for decision makers hub. In particular, in the business and community section, there are folks within Extension, within campus, who have this huge wealth of economic data for the state of Missouri. And we're talking about an approach to make that data more shareable, more accessible. And I think we're kind of already working down that track a little bit. But there are different, this concept that there would be different views depending on user roles and permissions, what would be freely available and what might be available for logged in users, and what might be kind of another, again, a revenue generating approach for folks who want that data potentially at a cost. Again, this idea of next on the list here of a more targeted sector specific report within the business and community realm. So their idea of a sector specific report was really more around workforce development, as that's kind of one of the major initiative areas in the business and community sector. So it would provide information about not only kind of the community content, social demographic indicators, but also have things like getting into assets, apprenticeship programs, trade programs, trade zones, workforce demands, the kind of flow of people and income. so that they can better make decisions about workforce development. And then the last use case was around an asset or network mapping approach. And that would be a platform that would be potentially a combination of primary data collection as well as potentially tapping into platforms that already have information about different assets. As we know, a lot of the connections that are made and the assets that are utilized in communities may differ from what's like in the yellow pages. So it would be a place where staff could go and enter what those kind of key resources are, kind of like a 211 list for specific needs in an area to help kind of build out that list for the extension staff. Any questions about those use cases? So moving on to youth and family. Youth and family had, again, identified a few distinct use cases. The one that kind of rose to the top was around this idea of a site selection and approval tool. And that really grew out of the need that was identified where programming for nutrition education in particular has to happen at sites that meet certain criteria. And their hope was that the process of selecting sites and getting them approved could be streamlined if there was a system in place that kind of had that data already available to them, so it wasn't reinventing the wheel each time they went to identify a new site. And that could be coupled with a list or a map of the currently approved sites to allow others to kind of see what's already going on in areas, who's doing what where, and see where gaps in service might be to help identify where we might need to place a new site. And the idea was that not only would that be a beneficial tool for extension folks, but it could have revenue generating possibilities since it's a requirement across all other states. And then there could be other applications beyond just nutrition education site selection. And second use case was around program data collection and reporting. So this was the thought, or one of the applications that was mentioned was for reporting on after school programming. And I think that was something that was also brought up during this session about work that's already being done, having a kind of a standardized way to collect and report back that type of information, as well as doing some primary data collection beyond just what the program requirements are, but to help kind of round out that context. And then the last use case was, again, a specific targeted report for the youth and family folks who are doing youth and family work, specifically looking, taking a deep dive to look at trends in education over time. So graduation rates, just numbers of students in schools, the assets flowing into schools, and things of that nature. And I'll move on to the use cases that we talked about in our session. So one that was floated was this idea of we're calling it here, the Precision Social Health Collection and Reporting Tool. So again, it was this idea that there is programming that's going on with requirements for reporting, for collecting data, for reporting data, even doing some analysis on data, and there's not a uniform system that allows folks to do that in a standardized way or in a very necessarily in a very efficient way. So the example was the Stay Strong, Stay Healthy program, where data is collected, a program is implemented, and we're wanting to look at evaluating the impact of that program. So building a tool to help house that data and then help streamline some of the analysis and reporting for those types of programs would be very helpful. The idea for a tailored sector-specific report was more around preventative health data, so indicators like vaccinations, immunizations, medical claims, preventative care measures like cholesterol, cancer screenings, mammograms, high blood pressure, et cetera. And then the last need was really around that emergency management use cases. And that could look more like what we've already developed for the community crosswalk tool, but again, with specific data sources or assets, data sets that would be relevant to emergency management. So and jurisdictions that would be relevant to emergency management. So what does the fire safety district look like? What assets are in this district, et cetera. So it could also show trends in some of the environmental conditions related to emergency management, so fires, weather events, et cetera. So I'm going to pause there again. I think I went through 2 sections there. Anyone have any comments about those 2?
Any takeaway from the first meeting after you thought about it, and the emails that came to you all, and that you wanted to share today?
Well, I think the use cases help a lot in terms of give me something to wrap my head around.
Yeah. The last couple of use cases, and I think that these are some of the ones that we really want to focus on. These were themes that we found throughout some of the different sessions, and we feel would not that the others won't, but for some of these would really well fit within this All Things Missouri framework, is this idea of the County Engagement Specialist report. So the report, a County Engagement Specialist report, you know, there are these new positions coming on board. So it would provide local data to these county engagement specialists to help them get this foundational understanding across these 4 different sectors: ag and environment, business, community, youth and family, health and safety, to kind of get them to better understand the current context of the places they serve, as well as some of the trends. And we're hoping that, you know, with this, it would really kind of set the stage for some of the work that's going to be done and allow for greater impact. We also heard that a potential use case in some of these meetings would be this county council impact report. And our understanding is that each month, or was it each month, yeah, the different county offices basically put together reports to their county councils. We don't know exactly what goes into those reports, but if there's a way that our data and tools can help make that report more streamlined, that process more streamlined, and you know, maybe we can't cover everything that goes in the report, but if we can get you 50% of the way there, or you know, 80% of the way there, that's even better. So how can we help with our current data tools so that we can help make those reports more standardized, more customizable, or what have you. And then finally, it came up several times that this idea of the researchers data portal. So what does that look like? Is there, you know, pop prints? What does login access look like for a research data portal? What types of research questions are we trying to answer? Is it just providing access to data? Is it doing some of the additional analysis? What does it look like? Those conceptions may differ across the different groups, but that was a need that was consistently brought up.
I have some questions on the engagement specialist. So they cover all 4 domains?
So we're kind of like a liaison for those domains. So if we see a need in our county that is ag related, even though I'm nutrition and health, you know, I still stick with my nutrition and health, but I might reach out to ag and say, hey, we have this need here. Can you have someone come in and address that? Or can you come in and do a workshop or something like that? So it's more like a liaison.
But the idea of this report would be to give you at least 1 or 2 facts on ag.
Right,
in
exactly.
your area that you could have. And,
yeah. Because I'm not a specialist in those other areas, right. And so
that's the concept.
Right.
You know that everybody's not specialists in all 4 areas. You ought to have some baseline set of information that
Right.
would help you to understand the setting of those areas, even if
Yeah.
the next step is still to go on to a more.
Right,
more
right. So
specific
yeah,
person,
if I
but,
saw a
yeah.
report like that covered all those areas, then it would help me identify those needs, and then I could then reach out to other specialists in those areas
Or
to
better
then cover it.
communicate
Or,
with the
yeah,
county.
exactly,
Yeah.
exactly.
Yeah.
And would that specialist be in your county or
Not
maybe in another
necessarily,
county?
yeah, it probably, it depends on the county, but very well might be another county, or it might be someone from campus coming in to do something as well. It's the way I understand the description of the position anyway. I could be wrong. But,
I know it's, the ink isn't dry yet, so.
Right. Yeah.
So how do you know who to refer them to then? Is there like, or do you?
I hope so.
Yeah.
There's training for this ES position that starts next week. So I'm hoping that these details will get ironed out. It's still, like you said, it's still a work in progress. I don't think anyone has a for sure definition on exactly what it will look like. And, depending on the county and your region, it might look a little bit different.
Yeah, and I think
across
that's
the state.
potentially another place where we could tap into this. So, having not only data about the ag setting for a community or county, but then also what are those, as we kind of have seen consistently popping up, what are those key resources, whether or not they're extension resources, maybe they're other community resources where you could reach out and say, well, here's an issue, we need like loans for farmers, what's the key couple of numbers I can call to make those connections.
Especially for newer people in the position, because we are throughout the state hiring a lot of new people.
Yeah.
I've only been with Extension less than 2 years now, and there's still so much I don't know.
Right.
So, someone who's been with Extension for 20 years might not need that list so much, but I still think it would be very beneficial.
Right.
I'm in nowhere do anything remotely related to ag, but my neighbor is a farmer. So, and he's like, it's a big family farm, multi-generational. And he says, the thing that makes their farm go is computers. And so he's when he's in his field, he knows exactly what to apply, when, where, because the computer's telling him. And then I said, well, what do you do when the computer goes down? He says, well, we're out of business. So I was thinking local workforce thing, with the community colleges. I mean, there's going to be more need for local tech. So in your job, how would you know about that need? And then what would you do? Because it crosses two sectors, right? Ag and workforce.
Right. Well, I mean, for one thing, it's about talking to people. That's another thing expected from the county engagement specialist is being very visible in the community and talking to people and knowing what their needs are. And you would hear those things from conversations. When we did our community needs assessment last year, they did focus groups out in the communities and brought people together, and that was a very common response. I remember we got was need for broadband, need for access to high-speed internet, so that way their businesses can thrive. So just doing things like that, doing assessments, I mean, that's what comes to mind. But if there is another way to make that easier, more streamlined, I'm sure we'd be open to to knowing about them.
Well, that seems like, I mean, those three things seem like a natural fit then, because you're, you would have you as your specialist report, but then the community council impact report could also be, I assume that report then would go to all members of the county council.
That's our understanding.
The assumption.
Yeah.
The assumption. And then so you all have a meeting, and it's like, oh, we have a resource for that, we'll plug that in there. We got a resource for that, we'll plug that in there. And then you notice these needs and resources come up over time, and then all of a sudden someone asks a question that then becomes like, there's not any research on that, which then gets you linked to you pop open the researchers portal and find out who's doing research in that area. And then, I mean, that's from the ground up. From the top down, I'm thinking all researchers, I mean, to the extent you have anything applied to what you're doing, the applied is going to be through you all. But you're going to be the natural network in those counties.
Does anyone else on the phone have anything to add or any comments about these different use cases or different ways you might see these use cases playing out?
I think somebody, as they gain more experience, will have a better idea of how to utilize these kinds of reports. Um, your examples with ag was kind of interesting. It's a lot of things that you just learn over time. And when the CES is connecting with the ag specialists who are assigned to that particular county, those contacts will bring a lot of knowledge and experience to that CES individual, and it will help be able to address the issues a whole lot better than where we can at this point in the transition where we're at right now. So it'll improve over time.
Right. So I think just kind of building on that, is there a way that we can take that knowledge, which is really internal to individuals right now, and make that more shared? So whether that's going from a specialist to a CES, or to maybe going from that CES to a repository where it's more available to, to folks if someone in that role changes, right now, what happens if we lose someone who's been in the field for 20 years, that knowledge kind of goes with them. Is there a way to make that knowledge have more lasting power? And whether that's through a report or an inventory or a list or something, it might be helpful to have a better documentation of some of those kind of more personal connections, really, is what they are.
In the West Central region, as I work with the CES, the individuals who are the CES folks, whether it's 4-H or nutrition or whatever it may be, the majority, all of our counties are classified as rural counties, and we have a fairly small population. So ag is big business in our counties, and it's not the only business, but it's a big business. And so I'm helping them to learn some of the reports that are available through USDA and the NAS reporting system, the Ag Statistical Service, just so they better understand the impact of ag in the community. And what that allows us to do is take someone who does not have much ag experience to where they can at least understand what ag is in their community and be able to talk about the impact of ag, which in itself will open up a lot of doors in our rural communities for the CES. And, anything we can do like that to help them is a big help. And the NAS reports are pretty easy to understand and pretty straightforward. And so I tend to direct several of our folks to the NAS reports.
And this is Chris. Was that Wayne? Who was that?
Yeah, Chris, it was.
Yeah, I have a question. So the data, and I know, Chris, you've been getting some of the ERS data, USDA data that's going to be available on All Things Missouri, as well as for other states. We can make that data all just publicly available, but what are some value-added tools that you can serve as a broker on with your clients? In other words, there's different ways to go with this. We could just kind of leave everything out there for the wind to pick up, and they can go directly to the site, but then that would bypass you all's good thinking and your knowledge. It's got to be curated somehow, and I'm wondering, how we go about doing that. Is it behind a username, password? Are the tools? I know Chris and the CARES team here, we've been talking about just making the data publicly available, but the value add tools like the reports or the ag site things, those are for extension field faculty to have, in their hip pocket. So as they're working with people, they're the gatekeepers, so to speak, with that.
Well, this issue came up in another project I was working on, and it was when you were talking about somebody leaving with 20 years. I mean, that was the exact situation we tried to capture, and because you're talking about tacit knowledge and implicit knowledge.
Yeah.
So in this other project, it was back in the day when SharePoint was used a lot, and it was a information and referral project. So there was for SharePoint, there was a public facing that the public could access, but then there's also SharePoint has a wiki tool, and so the behind a login and password was the wiki tool. So once you logged in, not only would you see the public, but you would also see a wiki. But it was essentially just a data field that was associated with that record. So you would have, like in our situation, it was you wanted to make a referral to this agency, regarding a particular client. So that's what the public would see. What the workers would see is make sure you call on Tuesday morning and ask for Betty and mention, a particular term.
Yeah,
And then that will get you through the front door.
right.
So do you all have like a text field that you could add
Well,
to the record?
here's the thing is we'll build whatever
Yeah.
that's what's so important is we could build it and just leave it for the public, and then they never get with the extension field faculty person about it. Or,
But if they don't need to, then they don't need to.
well, the
But then if
question
they
is,
call you and you're like, oh, what do I do?
Right.
And then there's that extra text field that says, oh, you need to call Betty because
Or-
she's
or we code in there as people get reports, by the way, contact your extension person, and depending on where they're getting the information from, here's the name of the person. It'll be different for different areas of the state. I mean, I'm just thinking through this out with you all because, Wayne, did you want to add to what we're talking about?
Yes, Chris, I agree 150% with you. Everything we do should drive people to the local office, and likewise, the office should drive people back to this. We should be a continuous circle, just going back and forth feeding each other, because what will happen is that contact will develop and a stronger relationship, and then they're going to start asking us questions about programming and things like that. So, Chris, I agree with you. We should always drive people to our local contacts, always.
Okay. Thank you. And this is good for all of us to hear, from the CARES team as well, in terms of how we can make that throughput happen. And then working with you all, by November, December, is coming back to you all and say, this is what we're thinking as a way to do that, okay?
Is there a way that we could kind of build in the flexibility to use some of the cropping budgets to kind of get a dollar profitability figure in on some of this, the production numbers that we see out of the AES reports and that sort of thing? We can make maps that have got the USDA production data on it, and that's all fine and well. Is there a way that we can put a dollar sign onto that so that people understand, have a better understanding of the cost and returns that our ag community sees out there?
Frank, that's a great suggestion. That's the type of sort of value add approach that we're talking about with some of these specialty tools, like Chris referred to earlier. The data is the soil, and then the tools are the corn, the crops, whatever you said. Yes, that things like that are certainly possible. It's a matter of identifying what would be a good thing to pursue, a useful thing to pursue, and then figuring out things like how you want to implement that, who the target audience is, etc. And to circle back around to something that was mentioned earlier, some of these tools could be available to the public versus available to extension folks only versus available on a fee for access basis if we want to talk about revenue generation. So those are the types of ideas that we would want to vet. And I hope, Melissa, you got that idea down in the notes there about the crops. Thank you.
Well, and this is down into the weeds level we need to get, because the CARES team, we're not content experts. We're really relying on each of the impact areas to be as explicit as possible. And with that level of explicitness, we can then code in to exactly what you're not exactly, but I think getting close to what you're talking about. So that's really good suggestions, and we need more of that. You want to add to that?
I'm done.
You're done? Any other comments on the phone? Because this is a very important discussion, because what we're talking about here carries over across all of the impact areas.
Well, I've got 42 years worth of experience, and in 5 weeks, I'm available as a private consultant.
There you go.
Well, let's talk with Blake, right?
Okay.
Okay, very good. Go.
Yeah, well, that was very great, and I think really helpful for setting the context for our next phase of the session today. So that's where we're going to actually ask each of you all here to really think about the different data sets or data or concepts or metrics that would help round out these use cases. So is it, whether that's in a report, and if that report, whether it's the CES report or the county council report or the public report, or if it's a kind of fee-for-service report that you might use in the field to give information to someone who's asking, whether it's the site selection or analysis tool, or a research tool, what are the data sets or metrics or concepts that would meet those different needs. So we'll pause, take a little break here for 10 minutes or so we can think about those things. For those of you who are here in the room, if you have ideas, I can write them on the note cards here and paste them on the board. I'm going to add the different kind of bucket areas to the PowerPoint here, so those folks on the phone will be able to see the different areas or kind of themes where we are currently housing data. And if you can contribute either through chat or just kind of jot down your own notes, and I'll pause for you to speak those over to us, and we can make sure to get those as well, get those documented.
So Angela, are they also supposed to think about the data elements or data sources that would support the 3 use case scenarios?
Yeah, I think that's all part of it. So
Okay.
we're in, the framing is within these different themes, so vulnerable populations, clinical care, health outcomes, health behaviors, but those would be the themes, but the use cases would be the different ones that we just talked about and identified. Okay, so for those in the room here too, we've got cookies, fruit, coffee, water, restrooms around the hall.
And
I'll take a soft drink and a cookie, please.
Yeah, I'll make sure to pour that right through the phone here.
we're gonna put you guys on mute for a few minutes so our noise doesn't drive you crazy.
If you want to hand that stuff over, I can put these guys up for
I'm
you.
not sure exactly where each of them are. Yeah, there's, I think most of them would be in
Give them a
vulnerable
1 minute warning.
populations for healthy and health behaviors. I would assume.
Let's see. No, go ahead.
There's depression on the list of elderly population, but that's it. And depression goes with a lot of things.
Right.
But there are lots of other things that are common.
What you got?
Should I put the easy review here?
Yeah, it's nice to have that here.
I don't know if that's even, there's not even much data on something like
Yeah.
that yet, but it would
You
be.
know what? I think the Missouri
Interesting
county level
report.
studies did start asking
Did they?
about that. This was last one I looked at.
Yeah.
But there's under health behaviors. You want to be here?
Behavior.
Yeah, I'm gonna grab some of these vulnerable population ones.
Jenna's vulnerable
Yeah, you can double check and make sure that.
Yeah. I mean, some of these kind of cut across the different categories, so I'll grab these guys first. We'll go through the categories here. Okay, everyone, we're back from break for you folks on the phone here. No, I think we're unmuted now. Yeah. So what we want to do is I'm going to switch my screen over here to actually look at the current health and safety indicators report, and we'll look at the different metrics that are in each of these 5 categories. Vulnerable populations is the first one. So the vulnerable populations category is kind of based on the definition of vulnerable populations for a health assessment report that we built, where we were looking at people who might be marginalized or might have issues with accessing care and might be more susceptible to certain health outcomes. So the current list is really just 4 metrics: population in poverty, population with any disability, population with no high school diploma, and population with limited English proficiency. Those are all 4 metrics that come from the American Community Survey, and kind of in bulk meet those criteria around people who might have be vulnerable to certain health outcomes. So what do we think about that category, first of all, and then is that too specific? Does that language fit with our understanding? And then what do we think about the metrics within the category?
I think it's an important one because I just know from a nutrition and health perspective, we deal a lot with vulnerable populations, whether it's elderly who are at high risk of falls, whether it's dealing with our SNAP population. Children a lot of times fall, I think, into the vulnerable populations in many instances.
Yeah.
One thought that I have is just your definition, population in poverty, 100%, federal poverty level. Right. I think people can be vulnerable and be above that. Sure. Because you have, the SNAP requirements, off the top of my head, is 130% of poverty level. And then, you have all these people who don't meet the requirements to get on Medicaid, but yet they can't afford insurance. So I think that maybe raising that level a little bit would encompass more people. I mean, that might be a little nitpicky. I don't know if that's
No,
no,
I was
definitely.
going to say the same thing.
I would go above.
Yeah, and another option would be to have an indicator that's just population poverty and then kind of break down those different thresholds. That's something we heard we had another session this morning. You guys were the guinea pigs last session, but we had business and community go first, and we had a number of different poverty level metrics in that report because, again, different thresholds for different program eligibility.
I didn't see 130 though. I may have missed it.
I don't know that that's
And that's just
in
the one that
there.
sticks out for me
Yeah.
because of SNAP.
Right, right.
And we deal a lot with that population. So
Right.
That would be one that would be nice to see.
Yeah.
So Angela, 130% is not a standard census category, is it?
I don't think it is, but
So
we
how
have.
did we,
Let me see if it's in
derive
the SNAP
that?
ed tool.
Yeah,
It's in the HUD, it's in the, not HUD, but it's the,
it might be an
it's in the
APS.
federal guideline.
We might not
Yeah.
be pulling it.
And I know,
Okay.
I don't have a lot of experience with it, but I know that when we're doing ethnic programming, we have to target the SNAP audience, SNAP eligible audiences,
Yes.
and we have something called the site roll,
Okay.
which I'm assuming I haven't dealt with a whole lot because they usually just pick a site as opposed to where we basically do direct mailing to households that are SNAP
Okay.
eligible. So I don't
Right.
know if that would be a resource where they get that information.
Yeah,
We have 100 and 185
in the other report.
Staff report.
in the staff report.
Okay.
Specifically, we
Yeah.
don't have 130.
So there are other potential metrics here. Well, any other comments on the 4 that are listed? Anyone on the phone have any thoughts? So moving on.
The chat.
Oh, yes, sorry.
I don't know if it'd be dealt with much, but what about recent immigrants? I mean, they might be proficient in English, but being a recent immigrant could still.
That's true.
Yeah,
So I think
vulnerable
there's something that
population.
we can pull in on like foreign-born population from the American Community Survey. There may be other sources of that information too. That'd be good. Yeah, and then we don't have like a section here for basic demographics, which might be useful to have too. Just something like, you know, total population and change in population. That is a category, and I think most of our other sector-based reports. So having just a general demographics category might be where we could throw in some of those information that might not be a vulnerable population, but would still be useful context setting.
I mean, it's highly correlated with poverty, but anything related to housing or transportation?
Yeah, we do have
That's somewhere
certainly
else.
metrics about that. Again, I don't know that it's been pulled into this particular report, but Melissa, just make sure we know those kind of broader social context metrics.
And then I guess food insecurity would be the third one,
Yeah, that's a great
speaking
one.
of nutrition.
Right, that's a really good one. Great. So I see a metric here around incidence of falls in older adult population, which I think is important. We do have a population that's food stamp or SNAP eligible versus receiving SNAP. So kind of two sides of that same coin. Does that fit in vulnerable populations? That perhaps the eligible population, or maybe even receiving, would fit in the vulnerable populations, and then maybe building out that social context category for the other piece there, maybe population receiving SNAP. Another metric for vulnerable populations would be pregnant women or teen mothers. We may have something around birth and outcomes in our infant and child health section here, potentially even a health outcomes, but that has teen pregnancy in particular has been in other reports, health sector reports that we've built out, has been something that we've looked at as a social and economic factor, more so than just a health outcome. So I think that's an important one to include.
Is access to family planning
That was something that came up a lot at our last session. I don't think we have really any good information on that, but locations of we have locations of, you know, local health clinics, county health clinics, primary care, OBGYN care providers. So those are important pieces of that puzzle. But I talked to Lynelle, she couldn't be here today, but she said just like locations of places where you can buy condoms is important, because a lot of folks, you know, might not know, or might be embarrassed to go to their local gas station, especially if it's the only place in their community and they know everybody. So yeah, I think that's a piece of the
I don't think there's
puzzle we
any
don't
formalized data set, because one of my PhD students, that's what her dissertation is on,
really,
is family planning information
yeah,
across the whole spectrum. Because there's not any, it's not the health department, I don't think, collects it on a regular basis.
yeah. So I mean, I don't even know where we could get a close proxy for something like that, other than, you know, we've got locations of health departments, family practice physicians, and OB physicians.
Grocery stores.
Yeah, really.
On that one, I see low birth weight. How about no prenatal care? I mean, I know they gathered that one.
Yeah, that is feasible to collect. Certain states actually don't ask that on the birth certificate, and birth certificate information is where we get a lot of information about prenatal care.
Well, this would be on the health record.
Yeah, I think it's on, well, that too, but there's some states that ask, like, what month did you start receiving prenatal care, like, on the birth certificate.
Wow.
So there's more consistent reporting on that, and it's something that was reported in CDC's National Vital Statistics System. But yeah, I think, so we don't have a great data on that nationally, but if Missouri has it specifically, that would be a good thing to include too.
Because that's correlated with all kinds of other stuff.
Right. So going back up to vulnerable populations, we have some information, or there's a data set here on incidence of falls in older adult populations. I think we talked about, older populations and younger populations potentially being listed as vulnerable. So maybe like having seniors, or percentage of your county's population that is seniors, and whether that's over 65 or 75 or what have you, might be a good way to kind of target to fit in that vulnerable population context. Definitely something about falls, I think would fit nicely in a potentially a health outcomes framework, but could also fit under that vulnerable population setting as well.
The other group this morning too, they talked about using generations, right, to kind of help explain some of that stuff out. Like if you're a baby boomer or a generation whatever,
right.
kind of, we can define those ages in there also to kind of help people grasp that whenever they're talking about groups of people.
Yeah, and they were really interested in looking at not just what's the current situation in my county with regards to population by these generations, but also what are the long-term trends, what's that looking like. So in certain parts of Missouri, we know, for example, there are counties that are becoming retirement destinations, or where just the population is aging. So having that framing in mind might be important when we're talking about, do we have adequate services for these different groups of populations? Is the a lot of what's talked about is the healthcare workforce growing at the same rate that the vulnerable populations or elderly populations are growing proportionally?
Is there going to be some way in this to, I guess you call it cross-reference? For example, with falls.
Right.
Some of the people who are vulnerable to falls,
yeah,
and maybe some of the same people who, I don't know, have ear issues, ear issues, or other disease processes going on.
Yeah, I mean, I think that's an interesting question to look at. So in terms of looking at that data or doing that analysis, I can think of, we could get potentially hospitalization records that might be at a person level where we could track that. But other than that, I can't think of how we would look at multiple conditions for a single.
Could you have two fields, age 85 plus and living alone? And can you combine those two? Because those are two different into one indicator.
Yeah, there are custom tabulations possible with the American Community Survey data, which is like the social context, and we get more at vulnerability. But in terms of linking that level of vulnerability with a health outcome, there's not a great way to do that. You can make some of those linkages with the Research Data Center, where you have a unique person ID, and you could go between the census data set and a VRFSS, but that, is going to be a small subset of the population that's participated in both those surveys. Yeah. But for research questions, that's, a really useful way to think about.
For you, if you knew 85 plus, living alone, and no transportation.
Right.
That's like a yellow light. That's
right.
flashing.
Yeah. Right.
Yeah. Well, and I was just curious. I did several questions on with older adults and falls and things, because we have programs directly related to decreasing risk of falls. Our Stay Strong program, our Matter of Balance, the new Tai Chi program that we have are all engaged on older adult fitness and increasing balance and flexibility and things like that, strength. And so it'd be nice to kind of see the trend over, see if we have fewer instances of falling in communities where we're holding these programs.
Right. I think that's a recurring theme, is that just the current community snapshot really isn't enough to give us understanding of what's going on. We need to see trends, or we need to at least see benchmarking compared to what else is going on in the state and in the nation. Well, that's great. That's great. So again, getting to the vulnerable populations pieces that have been submitted, we have elderly populations living independently. That also came up this morning. Percentage of the households that are single adults versus families. And then also those living in assisted living facilities or nursing homes. And I think that's doable, I think, with my current knowledge of data. And then we have some site information here. So FNEP approved sites compared to areas of high population of SNAP recipients. So kind of a second step. So not just are we looking at the vulnerable populations, but also what are the resources in those vulnerable areas. If we have time, I'd like to show you potentially our vulnerable population footprint tool, which would kind of show you a way to visualize how we can look at vulnerable populations with certain assets overlaid on top of that. You can kind of make that more compelling visual image to identify those areas. And then also locations of, again, key assets for food security, food pantries, other services for low-income individuals, Goodwill, Salvation Army, et cetera. And again, with other sites for vulnerable populations, nutrition centers, locations of fitness programs, and potentially information about transportation, whether that's transportation service, are you thinking more transportation services?
Like that was specifically for older adults,
Okay.
like what they have access to, especially in some of our more rural communities. You know, where are the nutrition centers where they can go for a hot meal? Is there an OATS bus available?
So it sounds like we're not really talking about vulnerable populations here as much as like health-related infrastructure. Is that what you're thinking?
For some of this, I think that would fit, but it's services that would serve vulnerable populations.
Right.
Yeah, but I think if we're talking about framing for the report, maybe that would move into a different section. But in terms of
I don't know what you call it.
Well,
Yeah.
it's things that would make somebody vulnerable.
well, the
like-
lack of those things.
Yeah, so I mean, say 85 plus, living alone, no transportation, but they're living, out at, whatchamacallit? Lenore, yeah.
Mhm.
So it's not an issue
Mhm.
because services are there.
It's
And that's
also,
what they're there
it's kind of
for.
like transportation desert. We think of food desert, we have like service desert.
Yeah. So it almost
Yeah.
need to be a calculated thing that you could filter in crosstab.
Yeah,
So these are the, I like the buckets, but it's, the buckets don't help you identify the individual drops of water that you need to then reach out to and figure out as a community, what do we need to do?
right. So does anyone else on the phone have anything to add in terms of vulnerable populations? It's the first category here. Check my chat window too.
I don't have anything to add, but I'm glad the issue of fall risk factors in our aging population was brought up, because as I explored through the 4 different links that you forwarded to us to explore a little bit, I tried searching in the search box words like fall risk, osteoporosis, osteopenia. I found a lot of other chronic conditions that have already been researched, but I didn't find any data sets related to falls. And I think, as someone mentioned in the room, that we have several programs that address that issue directly, 3 that I can think of. And so it'd be great to have some data to show what our fall risk population looks like in our communities, because we're doing a lot to address it. And I think we're going to do even more as our population ages in years to come. So I'm glad that was mentioned in the room.
Thank you. That's important for us at CARES to acknowledge too, that, we've been working with health partners kind of broadly, but since we are targeting this for our University of Missouri Extension folks in health and safety what data kind of meets those programmatic needs, and that's important to recognize. So I did just shift real quickly to a tool here because I want to make sure that folks around the room get a chance to see it. So this is something called our Vulnerable Population Footprint tool. So it was developed for, I think, for CDC originally, is that right? Or for Kaiser, or with CDC for Kaiser?
Actually, this is California.
California for Health. Was that
This
it?
is the California Health Partnership.
Anyway.
Kevin Barnett.
Okay.
Who's he
Yeah.
with? Yeah.
Yeah.
Anyways, it was intended to visualize the conjunction of two factors
Right.
that relate to identifying populations that are vulnerable to having limited access to health or limited or having health issues, et cetera.
Vulnerability to health issues, basically.
Right.
So we're looking at, in this situation, just low educational attainment and high poverty. So there are sliders here where I can actually change my threshold. So there's our census tracts. The ones in red are meeting both thresholds. So in that census tract, at least 20% of the population is below poverty, and at least 25% of the population has less than a high school diploma. So I could shift these sliders, and the tracks that are identified will change based on those definitions. So this is a potential tool that could help with site selection for certain programs if we're talking about vulnerable populations like seniors, those living alone, things like that. So just I wanted to give everyone this visual as an idea of a potential application, and you could overlay something like this with those locations of programming sites or of transportation hubs or of senior living centers, things like that. So it'd be more of a targeted tool, but a potential way to add value to that data beyond just the report.
Was that part of All Things Missouri, or is that a different website?
This is on our CARES public engagement network site, so it's engagementnetwork.org. It's our national presence, and it's free for the public to use.
Is there a link from All Things Missouri to this?
I don't think there is right now, but we could definitely add that in as a featured tool or resource.
Right. It's really a national resource, it's not Missouri specific, but yeah.
Yeah,
it would be nice
easy
to
do.
be able to easily navigate from one to the other, or
Right.
have it as a box in there somewhere.
Yeah, that'd be very easy to do. And this infrastructure is built so that we can really kind of plug in any number of metrics with minimal work.
Yeah, but as far as the use of the tool, once you get past 3 or 4 of those little sliders, it gets a little confusing to the user about, just what threshold have I set where, but you could theoretically go, put 100 things in that list, and
Right.
start moving the sliders around and say, okay, percent of population within 10 miles of a hospital and things like that.
So is
Right.
the data available on this similar to the data sets that we have? on All
Yeah,
Things
and
Missouri?
it's actually, I think some of the links in that email we sent out for the homework, the follow-up homework, included both All Things Missouri views of data as well as engagement network views,
Okay.
because this is national. It's a broader list. That All Things Missouri was like a kind of distilled subset of what's available nationally.
And does it automatically, above both thresholds, is that an automatic feature, or do you have to turn it on?
Yeah, that's an automatic feature. So if I were to set these both to,
If you added another layer, does it always have that option of above?
It'd be
Well,
about
it's
3 thresholds.
yeah, so it would be above 3. And we
Actually, we
built,
did one, and we had it meeting, 2 thresholds or meeting 3 thresholds. I don't know, is that location opportunity footprint there?
Yeah, I'll pull this up. It'll take a second to load. But another tool that we built using this same model is the location opportunity footprint tool. And this looks at the intersection of educational, is it graduation rate? Job opportunity and transportation.
It's housing, housing
Housing costs.
availability, transportation, and job opportunity.
School proficiency, and then it's this housing and transportation costs, yeah. So if I zoom again to, we'll go to Kansas City this time. And hopefully these layers will turn on. So you can see this is a much busier map. And actually this is at a finer level of geography as well. So this is at census block groups, whereas before we were looking at census tracts. But again, you've got locations meeting all 3 thresholds, meeting 2 thresholds, and then those that are just meeting one of the 3 here. You can see if you add any more, you're going to get a much busier map. I have seen an application where they only highlight areas or only select areas that meet thresholds, and that way you could add a whole bunch of different layers in there and you don't have multiple colors. You know.
Yeah, I think your Zoom just flashed on.
Oh.
Somebody just chatted.
I think you rolled over.
Yeah, I think I just did it.
Oh, you rolled
Yeah.
over it. I'm sorry.
Yeah. So before I jump back to the other data list, does anyone out on the phone have any questions or thoughts about these 2 tools here? Okay, so I'll jump back to the data list and just go through what we have here for clinical care. So you can see there are several access-related metrics currently. So these are about rates of ratios of population to providers in different fields, mental health, primary care. We can break those out further depending on what the needs are. We're looking at federally qualified health centers, and then we have looked at some shortage areas. So there's population living in a health professional shortage area here. And then what limited information we have here on preventative care. A lot of these preventative care metrics are for the Medicare population because that's what we have data for. CMS makes a lot of their data more available. We don't have, universal data on non-Medicare, Medicaid populations other than from something like the behavioral risk factor surveillance system. So that's what we have listed now for clinical care. It looks like our board is somewhat empty here, but I know we have heard around the table some ideas that maybe get into this area. Does anyone else have any thoughts? Anything that maybe we should add or remove?
Yeah, anything that needs to be dropped from this list. I mean,
or that's unclear from this list? Yeah.
Yeah. Trying to find on their access to behavioral health or mental health services.
We have providers. I have a map data set around something like substance abuse treatment facilities and mental health treatment facilities.
We have therapists, access to therapists.
On the Missouri report?
Yeah.
Yeah.
So.
Yeah.
Well, that would be needed.
Yeah, so we've worked with the National Provider Remuneration Data System, so that has like every provider with a NPI code, and we can kind of break that down a number of different ways, as well as working with the Missouri Health Net Provider List, which also goes through most of that.
I'm thinking here, you mentioned the access to substance use. Would that list include AA meetings and things like that happen in churches and all of that? Is that included in the data set? Do you know?
Don't think so. I think it would just be unless those sessions or organizations have an NPI code. I wouldn't think so.
Not
AA. Now, if those are, I don't know how those operations are organized, but if they have like a tax exempt code, we might be able to pull them.
I usually I would find it if I was doing a Google search and AA meetings in my area. I could probably find it that way, but I don't know.
Yeah.
That could be a primary data source.
Yeah.
I was gonna say in the business and community group, we talked a lot about doing like an asset or a network map.
Right.
For those types of services, and it would be on the extension folks to do primary data collection and input that information into the system. Because those types of things, I feel like sometimes locations change,
Right.
sometimes the times change, those kinds of things. And so it would be something that if we were to just scrape data to get that, it might not be helpful, right? Yeah. But having that local connection would probably be
Yeah.
Thinking that it might be nice to have some of those local services, what's available in my area for
Mhm.
referring people.
Right.
If needed, so.
Yeah, I think that's really important. I think identifying categories of things that we would want to collect
Right.
for those asset maps is
Yeah.
a really important next step, because that's, I think, something that we're looking to do already, but being, you know, we could do everything with that and then get nothing accomplished, or set our sights on everything and get nothing accomplished, but having a subset of a few types of
Well,
facilities would be very good.
I'll do my
Even-
broken record. I'll go ahead.
Yes, go ahead, sorry.
Even in the county data, that data might be, it might fluctuate to the point that somebody would really have to stay on top of it to make sure that the
That's
information's accurate.
Yeah, that's very true. Chris, would something like that Aunt Bertha have information about that, or?
Yeah.
No, they might.
Yeah. 211 and Aunt Bertha will have AA information.
Yeah, yeah.
And that's my broken record about 211.
Right.
I
So
think,
you were gonna say, okay.
yeah, just for the minutes again. They'll mention 211 again. I think the university should take it on.
I think so too.
No, seriously, they
Yeah,
should.
that'd be great.
Yeah.
Yeah, that would be a great first step. Like Jamie said, it might be totally out of date, but just start with a
Oh.
list.
Well, see, but
of
this is
something.
where the engagement specialist, because this came up on my other project, because of the out-of-date information, but the users of the information will keep the information up to date. So you
Yeah.
call such and
Right.
such church, you
Right.
still have your AA meeting on Tuesday night, no, we changed it to Thursday night, it's gonna be that way for the next.
Yeah.
So you go in and you update it,
Right.
and if it's used, it will be updated. If it's not used, it won't be updated.
Right.
Well, and if, I mean, I don't want to accidentally volunteer us for more work because the CES role is already going to be
Write
pretty
this down.
big as it is, but I'm just thinking for myself, because I have one county that I'm CES of, and it's rural. There wouldn't be that much in my county to have to keep updated. So
Yeah.
just speaking from,
But you can
for
tell-
myself, not for all the other CES there, for myself, that's something that I could see myself
Yeah.
being able to do.
Yeah.
But, I mean, getting with our online program, because I do a lot of stuff with online, and I've mentioned this to Gilbert Rankin and a few other folks, is that we have students that have to do service learning projects. This would be a wonderful thing to task them with,
True.
is to, update all the community resources in your county.
Right.
And they're
Good idea.
they're not in every county yet, but eventually they're going to be in every county.
So anything else in terms of access to certain types of facilities or providers, or metrics for monitoring actual, clinical use that we're missing here now? And some of these things might fall under health behaviors or outcomes as well.
I think it's a great starting place.
Okay, great.
It'll be 4 times as long this time next year.
I know, that is the risk that we take. So the next section here on health behaviors, and again, some of these preventative or prevention behaviors could fit within health behaviors, but we're looking at specifically things around diet and substance use and abuse. So we have fruit and vegetable consumption, expenditures, alcohol expenditures, some information around opioid drug claims, and then tobacco use, tobacco expenditures, physical inactivity.
Opioid drug claims, is that referring to people who are receiving prescriptions for opioids? Is that what that?
Yes, it is, and I do believe it's a CMS data set, so I think it's just a subset of Medicare and Medicaid users from their prescription drug claims database.
Is that dated a little bit then?
No, it's
CMS?
very current.
Oh, is
Actually,
it?
CMS
Okay.
is way more current than anything on like overdoses and things like that, because those usually are multi-year aggregates. The CMS stuff is usually a 1-year delay.
Yeah,
I was gonna ask if there's anything more current in Missouri, but I guess there wouldn't be.
I don't think so. Now, Missouri does have like an opioid dashboard, but it doesn't have a ton of information there at the county level?
I think the best indicator that folks are using right now is the poisoning
Drug
mortality.
poisoning, and that's a
Big-
5-year
yeah.
average.
And that's like what I've seen, because there's a Kentucky group that we worked with out of ARC they built a dashboard just around opioids, and that's their base layer is that mortality data.
Yeah.
So I'm just not sure that it's out there in terms of the total of drug claims, opioid drug claims outside of the Medicare population, or the number of overdoses, because just like with any other violent crime or crime-related data, some precincts don't report. So there's pockets of reporting.
Yeah.
Now, I know locally, the news every so often will report on how many times the fire department has administered the drug on site. I wonder if there's any type of record keeping.
Yeah, there's that varies by police and fire department to fire department. As far as I can tell, the naloxone and whatever it is, there's a section for that on the Missouri opioid dashboard, but there's nothing that you can pull. They do have data on overdose hospitalizations. I don't think it's county level though, it's like region.
But 911 calls for overdoses, is that something that's tracked?
I don't know. Do you guys have any idea?
That's tracked. I don't know who it depends on the jurisdiction for the 911.
Okay.
So yeah, it's tracked.
It goes back to that Missouri 911.
Gen 911.
Yeah, we're behind on that, right?
Missouri's behind.
Hey, this is Erin. Can you hear me now?
Yes. Hi, Erin. How are you?
Doing good. So as far as it goes for fire departments and for 911 dispatch centers, to my knowledge, unfortunately, those are not extensively standardized as far as reporting requirements. If you go to the state fire marshal's office, they cannot definitively even tell you where all the fire departments within the state are, just because of different organizational structures. There are some national reporting databases, some INFR reports that are done, and they're done on the qualification that you do this reporting, you are eligible for some federal funding opportunities. And so even that is not consistently widespread, because some folks just write off that they won't get it, so they don't bother doing the reporting. So there are some data sets out there, however, they're probably not universally reliable.
Okay, well, that's great to know. It's a starting place anyway for some data, even if it's not wide, doesn't cover the whole state. Great. Erin, do you know if there's data on the naloxone, that's what it's called, right? The supply, because that would potentially be helpful, or at least a way to look at, where it's being supplied or used.
Definitely. My first inclination on that would be to contact the company, because it is so limitedly manufactured. I wonder if there's some way we could get distribution. It won't tell us about the application and usage, because honestly, a lot of that, hopefully, statistics say contrary, but hopefully I would want most of that to expire in the storeroom and not actually be used, or not actually be needed, I should say. But I'm sure there's ways that we can find out some inclination about how that's distributed and where it's being most regularly purchased.
Right. That's great. Thank you.
Who wants that? We have a bunch on that.
Oh, yes. Health behaviors. Okay. So a few more topics for health behaviors here. So we have the types of more mental illness. So the current platform, I think this is under outcomes, but we have information about, I think, just depression.
Poor mental health.
Poor mental health. Poor mental health. Do we not even have depression on here? I guess not. So
Depression is somewhere on there. Because I was surprised that only depression.
Right.
It may not be there.
We definitely have a math indicator for it, or it might be in the public report. But the other mental health conditions, such as bipolar disorder, schizophrenia, others. Again, I believe we can get data for the Medicare population, for the older population, in terms of other mental health diagnoses. So that's something that we could pull into the platform.
Do you have access to anything from like VA hospitals? I'm just thinking about like PTSD with veterans.
Yeah,
Is that something you could access?
That's a good idea. I don't know, but I would think that their data would be more standardized. Because again, it's a federal insurance program. But I haven't ever seen data on VA claims. Have you, Chris? Yeah, that's a good. I will look there. So again, we have information about opioid use among pregnant women in particular. I do know that there was a health report out somewhat recently on neonatal addiction syndrome. And again, I can't remember if it was county or regional data, but it would certainly be something we could pull into the platform, and that is probably the best measure of opioids among pregnant women. Do you know of any other? Do you have any other? Was there anything, a particular data set in mind that you were thinking of?
No, it was just when I was looking at this stuff, there were just things that, because I was looking at it, preparing for some things that we're going to be doing.
Right.
And it was just information that I was wishing was there.
Yeah.
So the health department should have positive drug screens, though. I mean, at birth. I mean, they have that data.
Yeah.
Combine that with lack of prenatal care, and it's a flashing red light.
Right. Yeah, that's another
You
good
got to
place
get
to
out there
look.
and fix it.
Right. That's a big issue to tackle. So other substance use data around health behaviors. So other than tobacco, alcohol, opioids, would there be other particular substance use issues or
it may be
areas?
up there, but a lot of times, substance use, people use a lot of different things.
Isn't meth on the rise
all at the
again?
same time.
I've read a few articles about how meth is supposed to be back on the rise.
Oh, meth never went down.
Well, yeah.
Mhm.
It's starting to be in the headlines more
Yeah.
again.
The people who use meth is a little different population than people who use opioids.
Right.
I mean, there's certainly some crossover, but in my experience, meth.
Yeah. In my area, meth is a bigger issue than opioids. And it never went down.
Yeah.
It is.
What information is reported on that? How do you get a sense of what, is it
Usually court records.
hospitalizations or?
Yeah, court records.
Okay.
Or
Drug house bust,
Yeah.
Yeah.
Those are reported by.
So it'd be more on police records than like health-related claims?
Yeah, because in the
Okay.
hospitals and the healthcare facilities, it's gonna be private information. That's where I've seen it, but you get the numbers, and then I'm not sure. Well, you have to get the numbers wherever you get the numbers, which may be with law enforcement.
Right.
More than with the healthcare facilities.
Okay.
I don't know if this would help in any way, but I know they track that, you have to show your ID and they track you in the system for cold medication, buying the stuff that has the pseudoephedrine in it. I don't know if that would tie in at all, but I just know that's something that's being tracked.
Right.
By all pharmacies.
That may be a place though,
Because once you buy a certain amount, like you're put on a list and you can't buy anymore.
Right.
I don't know.
This is Erin again. There's also another resource you might consider is through DNR. They do hazardous waste disposals, and a lot of times law enforcement will turn to them to dispose of clandestine labs and drug seizures and stuff like that. So they might have some records also that might be of interest.
That is great to know. Never would have thought of that. Thank you. So moving down the list here with what was submitted on the board, also e-cigarette use. So I was mentioning, since it's so new, there's not a lot of information out there, but I think it was a metric that was, or a question that was asked in the most recent Missouri BRFSS or county level survey, so we may be able to pull some information on that. It would be, I think, primarily for adults.
And along those same lines, I was thinking somewhere on one of these lists, I saw tobacco, but then there are different types of products. I mean, the e-cigarettes is one.
Right.
I was thinking chewing tobacco,
Yes.
snuff.
Yeah, so having a data source that makes that distinction between different types of tobacco and then being able to report that out would be very, very useful, because there's obviously different types of interventions that need to be in place depending on the type of tobacco use. Even different things to look for in the populations in terms of their outcomes. So a few more around violence, domestic violence, childhood violence and sexual abuse, physical abuse, other forms of maltreatment.
Yeah, maltreatment.
Yeah. So we had,
That's sort of an endless list.
yeah, there was a data set at the zip code level on adverse childhood experiences, but I don't know that's going to be kept up to date. But it was fairly recent, and that's in the mapping platform, but we don't have an indicator metric around that, so that would be a good next step since it's already there.
Well, one thing about some of that data, when it comes to things being outdated, it may not need to change.
Yeah.
For example, with sex abuse, it could be even as much as 5 years old, and it's probably still in the ballpark.
Right.
Some of that stuff, I don't know that it has to be fresh like yesterday.
Yeah.
Well, and I mean, even if something happened to those people, 10 years ago, it's still affecting them. So
That's
it's still
true.
affecting your population
Yeah.
once it's happened.
Yeah. So I mean, there are emerging issues like opioids, and then there are kind of longstanding community things like poverty and potentially other issues. So
On abuse, don't you get that data from the state?
they, in terms of publicly available resources, there's not a lot at the county level, because they're, they want to protect privacy of individuals.
But they'll have it, they'll have it at the circuit level.
I would think so.
Yeah, they do.
Yeah.
It's on their public site.
That's true.
I think we put that out on the MOCAN
Do
site.
you? Okay.
So,
The child abuse and neglect.
Yeah.
Yes.
Yeah.
And there's also some juvenile data that's in there too.
Okay. Well, good.
Well,
Well, you
like
do start right
foster-
over there.
foster kids stuff.
That's right.
Yeah.
Yeah, and I think homeless youth is there
Yes,
as well.
it is.
Mhm.
Yeah. Yeah. So I think that covers the health behaviors fairly well. Anyone else on the phone have anything to add for health behaviors that we may have missed?
And Angela, we want to watch our time too.
Yes. Well, we're getting there. Okay, so scooting on down the list here to health outcomes. So there are a lot of chronic disease outcomes, mortality outcomes, and then a few around mental and dental health and STDs, STIs. So are there any categories of mortality that that you all would like to see added? For some of these metrics, we're looking at current trends in cancer in mortality rates. We may have some trends over time, more likely at the state and national level, and then some breakouts by age, race, ethnicity where possible. And that's the same is true for this cancer information. So where possible, we're looking at not only the rate, but the rate by different population subgroups within a county.
What's the definition for premature death? Is that?
So yeah, that's a good question. There's several different definitions. One that's used is deaths occurring before age 65 or before age 75. Another one that's used is preventable death. So those would be deaths due to conditions that, if caught early would be treated, and things like diabetes would be included in that list. There's a long list. I can't think of all of them right now, but basically anything that's a chronic condition that's preventable would be included in that list.
I know I probably wouldn't use it, but it's just my own curiosity.
Mhm.
What about something like childhood death, like before the age of 18?
Yeah,
Not necessarily infant mortality, but childhood,
Right,
like due to
youth and
drownings
adolescent.
or accidents or things like that.
that's a great idea. Yeah. Yeah, that would definitely be easily reportable and added to the list. Easily. So moving down the list here into infant and child health, we have some birth outcomes. There's some data on breastfeeding rates. I think those are state level data more than county level. It's difficult to get data at the county level on breastfeeding. In fact, a lot of data on children's health is very difficult to get at the sub-state level. But again, we haven't spent a lot of time looking at Missouri's resources for children's health.
There's your child abuse.
Yes. Yep. One on our list here that I've added in was around childhood immunization rates. It's come to our attention that the state of Missouri doesn't have a publicly available resource on childhood immunizations. So we are working with the state to get access to at least the rates at public school districts. They do not report like fully fully immunized measure, which is like 4 doses of this and 3 of this and blah, blah, blah. It's like disease specific. So what's the number of children fully immunized against measles, against Hep B, and so on and so forth down the list. So we're working on that. It's coming down the pike. And then there's also an interest in finding data on HPV through conversations with Linnell. That was one of her topic areas that she was interested in. And
I also wonder if something to add to that is like lead levels or lead screening, that sort of thing.
Yeah.
That typically happens at the infant child level as well.
Yeah, there's a new map application. I don't know if it's that new, but Reuters has like a zip code level blood level map. They don't make their data downloadable, so I don't know how I'm going to get it, but yeah.
So
But it's
look
really
at it
cool.
and write it down.
I know, right? If I scroll over each zip code, in the state.
Be an intern.
I know, right?
Is autism somewhere, not necessarily right here, but is autism somewhere on the list?
It is not on the list, but that is another great one to add. Yeah. In fact, any like chronic conditions among children would be useful. I don't think we have any too much around children in the childhood phase. You know, it's birth and then some social data.
Even things like diabetes in children. I mean, type 1, of course, but then you're seeing increasing rates of type 2 being diagnosed in children. So that might be interesting.
Can you get IEP and 504 data?
No, can we?
Like school district,
Yeah.
maybe?
Yeah, maybe so.
I don't know if they release those counts or not.
You know what?
I'll be honest with you, but,
So there's data on the test scores, and with that you can, I think, pull out how many children are taking or are taking like special tests
Accommodated
because of
exams.
IEP and so on and so forth. So that might be a
So
way to look
really-
at that.
So really insightful one would then be looking pre-K for any child behavioral health issue.
Right.
And then you get a prevalence rate for a county, and then compare that to the IEP and 504 count.
Yeah.
That rate's going to go way down.
Right.
Because they're just being underserved
Right.
once they hit the schools.
Yeah.
So that
Yeah,
would be.
that's an analysis, but
Yeah.
that's right. Of course,
Right.
you have to crosswalk between school districts and county boundaries.
And then some school districts do a good job, and that would be a good conversation at a county level. Yes, because some families move just because of that. and it shifts the tax burden and
Yeah.
all kinds of stuff, has a business and economic downfall.
Right.
So you want to check with the folks on the phone?
Yeah.
before they might have to
Yeah, so
log
just got a
out.
couple more minutes here. I wanted to pause and turn it over to anyone on the phone who might have a additional data set that we didn't cover or mention today that you want to throw in the ring. Make sure we get it in our notes.
This is Erin. I didn't have anything else for you. Sorry.
Oh, that's great.
Okay.
Okay. Well, we went over quite a lot today, and I really appreciate everyone who contributed. I think we've got some great ideas and potential leads on where to find some of this next data. So we will follow up again after this meeting with a Zoom recording of what we've talked about with the slides. We'll kind of distill some of this list and of the new data topics that we've talked about and send that along as well. Of course, if you have any other ideas about data sets or concepts or gaps and something that's missing, don't hesitate to send them our way. We also talked last session about potentially putting together a shared, like a Google Sheet or Google Doc that we'll send out to the team. We'll take the first pass in adding these thoughts, and then if folks have new thoughts as we go along to add them there, it would be a good way to do it too.
Just to remind folks that on November 29th at I believe it's 10 a.m., we'll have the final meeting of this series with this group. There'll be a user experience meeting. Melissa and Jin Tang will be heading that up. And but then also in that meeting, we'll kind of do a wrap up of the 3 meetings and summarize before we go from there.
Right.
Yeah, one thought. I couldn't remember, is there any data sets on LGBTQ population demographics?
Yeah, we talked about that again this morning as well. There's not a,
I mean, I'm sure there's not a lot of data out there.
Yeah, as far as we know, there's really nothing being gathered nationally by the Census Bureau, which is like one place to look. There was talk about having that as a question on the most recent American Community Survey, but that was scrapped. There are folks who are interpreting things like same-sex households and getting some estimates from that. But in terms of LGBT health, I can't really think of anything. You have something like HIV is broken down by HIV in homosexual men, but that's really the only thing that I've, in my experience, seen.
We might have to lean on like some local St. Louis or Missouri related agencies. So I know like Promo in St. Louis, they do like a kind of a count, right? But it's imperfect, right? Yeah, but there could be there could be some other ways of getting at that too, through local organizations and the people that they serve, where we could come up with estimates.
No, luckily RAIN provides a lot of services to that population, and they have some, and they receive grant. RAIN.
RAIN?
Yeah, the blocking on the rape and anyway, it's RAIN.
Okay.
And they have state and federal grants, so they have to report out.
Yeah.
And so that could be some primary data that you can just easily go by and get, right. So somebody would need it, but it'd be very helpful to have it because it's just it's a vulnerable population and
just a population with different needs and different ways to approach when health is concerned.
It looks like Gallup might have some data for LGBT population. I don't know if it's for purchase or not, but it's like state level.
Yeah.
Yeah, so we can look into it though for sure. And even if we start with something that's state level, it's better than not having anything, right? So it's a 2017 analysis by Gallup. Anyway, keep going. Yeah.
Well, I think that's about it. If anyone has questions at any time for the next month or so, definitely don't hesitate to reach out to myself or any of the other folks on the team here. We appreciate you all being here. Take some cookies and fruit with you on the way.
Yeah.
Great.
Yeah, overwhelming.
Dale, how do you spell that group? It's RAINN.
Yeah.
Yeah.
I tried Googling it, and I was like, nope.
The rainfall was,
Yeah.
Yep, that's it.
thank you on the phone. Bye-bye.
Thank you. Bye.